Dr. Ryan from Gentling Dental, and today I'm here to talk to you about cosmetic dentistry.
Dr. Ryan, what is cosmetic dentistry and how can it improve my smile?
Cosmetic dentistry, first off, most dentists I know, pretty much every dentist I know, is a cosmetic dentist. Dentists work with front teeth. They're trying to do the best job they can at recreating a natural-looking smile, a natural-looking tooth. Cosmetic dentistry, there's a variety of possibilities of what that means. It can be as simple as a chipped tooth that we just smooth or shape. It can be a missing tooth structure that needs to be rebuilt with some filling material, or bonding is what some people have heard of. And it can be a veneer, a lab process veneer that is made by a dental lab technician, or a full crown. Also today in cosmetic dentistry, that includes implants, which are going to be very, very common and very popular. Very good results with dental implants. And then, of course, dentures or partial dentures are part of cosmetic dentistry, because anything that enhances the smile, that makes us think of our cosmetics, is cosmetic dentistry.
What is dental bonding?
Dental bonding is essentially a direct method. When we think of dental bonding, it's a direct method of filling material to replace any part of your tooth that's chipped, broken down, missing. The bonding is a little bit less, it's a less expensive way to fill in the missing tooth structure. It may not last as long as a veneer or lab-created porcelain way to replace a tooth structure, but it's just some filling material that's tooth-colored. We match it as best we can and fill it in and make it contoured and shaped and function in replace of the missing tooth structure.
What are dental veneers?
Dental veneers are an indirect method of replacing tooth structure or closing gaps, spaces, broken tooth by porcelain. And veneers today can be very, very thin. There is actually quite a popular movement of these no-prep veneers, which you definitely want to be a little cautious about, because it's very limited on who can actually be a candidate for the no-prep veneers, meaning the dentist doesn't have to drill off any tooth structure at all to have the space for the veneer to go over. They're like, at times you can think of them as little eggshell of tooth structure that are placed and bonded right over your teeth. And veneers are very aesthetic, and they look good. A lot of that depends, of course, on the laboratory that you use.
What should I look for in a cosmetic dentist?
What you should look for in a cosmetic dentist would be before and after photos, cases that they've done. Ask about the experience level that they have. What type of photography they use. If they use photography, you definitely want to have someone that is very familiar with photography. Photography is a huge part of it in communicating with not only you as a patient, but also the laboratory technician that's going to be helping us if we're doing veneers or crowns or an implant or even dentures, partial dentures. Anything that requires a laboratory technician, you want to have photography as a huge part of the process. That's the communication process. So with that being said, you want to look for a dentist that has taken extra courses, studies with institutions, aesthetic institutions. So you want to just ask them where they've learned beyond dental school, because dental school does teach cosmetics, but to a certain degree. But anybody that, if you want to have it done well, you'd want to go with someone that's taken extra courses and studied. And we're not talking about a weekend course. We're talking about courses that are 3 or 4 days at a time, multiple times, to study this at the level that you would want. Which also makes me want to stress that there's a huge difference in the quality of laboratory technicians, the ones that are going to be fabricating the veneers and fabricating the crowns or the implants or the dentures, which is sometimes gets overlooked. It's unbelievable the difference in quality of the dental technicians that we see, and the difference in prices, of course. So those are all just good thoughts for you to think about when you talk to your dentist about cosmetic dentistry.